All right, let's get right into it. We're about to solve a medical mystery. And what's really wild is that it connects a serious modern health problem to a tiny little feature, something we all have before we're born but are supposed to lose. Think about this for a second. A healthy 30-year-old having a stroke. It just doesn't sound right, does it? Usually we think of strokes happening to older folks, people with known risk factors. But what if a young, healthy person just has one? Out of the blue, with absolutely no clear reason why. Well, that's the puzzle we're digging into today. And the answer, believe it or not, often has nothing to do with lifestyle or some recent sickness. It's actually hidden in a little piece of our anatomy from before we were even born, a part that, for some of us, never quite finished its job. So, to really get a handle on this, we need to talk about what doctors call this kind of event. It's known as a cryptogenic stroke. And the name itself kind of gives it away. It's a stroke that is, by its very definition, a mystery. Basically, a cryptogenic stroke is when doctors have run all the tests and ruled out all the usual culprits, things like clogged arteries or an irregular heartbeat. And here's the kicker. This is way more common than you think. We're talking up to 40% of all ischemic strokes. The cause is just a big question mark. And this is especially true for younger patients, people under 55. So if it's not any of the usual stuff, what's going on? Well, it's time to meet our prime suspect. It's this tiny, hidden passageway in the heart, and get this, up to a quarter of us, 1 in 4 people, are walking around with it right now and have no idea. It's called the patent foramen ovale, or PFO for short. So what is a PFO? The simplest way to think of it is a small opening between the heart's 2 top chambers, the atria. But it's not really a perfect hole, it's more like a little flap, almost like a tiny tunnel. And the really important part? Every single one of us had one of these before we were born. It's a standard feature. And you can see it right here in this diagram. See that little connection between the 2 top chambers? That's it. A great way to picture it is like a little trap door that's supposed to swing shut and seal itself forever right after we're born. But for a lot of people, it just doesn't. You're probably wondering, why would we even have a hole in our heart to begin with? Well, it's actually essential when we're in the womb. See, before we're born, we get our oxygen from our mother, so our lungs aren't really in use. This opening lets blood take a shortcut and bypass the lungs. Then the moment we take our first breath, the pressure inside our heart changes dramatically, and it's supposed to slam that little flap shut. But in about 1 out of every 4 people, it doesn't seal up completely. It stays patent, which just means open. Okay, so we've got this little trapdoor, but how on earth does that cause a stroke? This is where the story gets really interesting. It all comes down to a clot taking a bizarre journey through the body, a journey it should never be able to make. They call it a paradoxical journey. See, your body has this really cool built-in safety net. Sometimes tiny little blood clots can form in your veins, maybe in your leg or somewhere. Normally, that's not a huge deal. The clot travels up to your heart, and then the heart pumps it into your lungs. And the lungs act like this amazing, superfine filter. Their tiny vessels catch the clot, and it never gets to the other side of your circulatory system, where it could cause trouble, like in your brain. But with the PFO, everything changes. That same little clot from your vein arrives at the heart, but instead of making that normal turn to the lungs, something happens. Maybe you cough, or sneeze, or strain, anything that briefly raises the pressure in your chest. That pressure can push open that little PFO flap, and just like that, the clot slips through the shortcut. It bypasses the lung filter completely and is now on the arterial side of your body with a direct highway to your brain. That is a paradoxical embolism. So to put it simply, that PFO is a shortcut. It's a secret passage that lets a clot sneak past the body's main security checkpoint, the lungs. It's a complete breakdown of a really important safety system. And the link here isn't just a theory. The numbers are pretty staggering. If you look at people under 55 who've had one of these mystery strokes, almost half of them have a PFO. That's not a coincidence. That is a huge correlation, one that you just can't ignore. Now, a stroke is obviously the most common and, frankly, the scariest outcome. But the brain isn't the only place these rogue clots can end up. Once they take that shortcut, the threat is really to the entire body. Just think about it. Once that clot slips through the PFO, it's now on the arterial superhighway. It can take any exit. It can travel to literally any organ in your body. So yeah, the danger is absolutely body-wide. And what does that mean? Well, it means that same little clot can end up blocking an artery in the heart, causing a heart attack.
or it could go to the kidneys and cause them to fail. It could even block an artery in your eye, causing sudden blindness, or cut off blood flow to an arm or a leg. The mechanism is exactly the same, it's just a question of where the clot ends up.
Okay, so let's say a young patient has one of these mystery strokes. What happens next? Well, the investigation turns to hunting for that hidden shortcut. And if they find it, the next question is, should we close it for good?
The main way doctors diagnose a PFO is actually kind of clever and surprisingly simple. It's called a bubble test. They inject a saline solution, salt water, that has tiny, completely harmless microbubbles in it into a vein. Then they use an ultrasound to watch your heart. If you don't have a PFO, the bubbles go to your lungs and just dissolve. But if they see bubbles pop up on the other side of the heart, the wrong side, bingo. They know the bubbles must have taken the shortcut through a PFO. So once they find a PFO and they think it caused a stroke, there are basically two paths forward. The first is medical therapy. This means using things like aspirin or other blood thinners. The goal here isn't to close the hole, but to make it much harder for those dangerous clots to form in the first place. The second option is actually closing the PFO. It's a minimally invasive procedure where a doctor guides a small device up through a vein in your leg and uses it to basically plug the hole, blocking that shortcut for good. Now, it's important to know that closing a PFO isn't the right move for everyone who has one. Remember, 25% of people have them. The research we have now suggests that the people who benefit the most from closure are younger patients, say under 60, who've already had a mystery stroke and whose PFO has some specific high-risk features, like it's particularly large or it has this other thing called an atrial septal aneurysm, which is basically a floppy piece of tissue next to it. But, even after all this detective work, there's still a really big mystery left. And this quote from one of the sources we looked at just nails it. It asks, if only about 15% of the blood leaving the heart actually goes to the brain, then why do the vast majority of these rogue clots end up causing strokes? Why the brain? It seems like they should be going elsewhere more often. And honestly, we still don't have a great answer for that. It's pretty incredible when you step back and think about it. This tiny little flap of tissue, this forgotten leftover from our time in the womb, can completely change the course of someone's life decades down the road. It really makes you wonder, doesn't it? What other secrets from our own developmental journey are still hidden inside us, just waiting to play a role in our health later on?